All right, we have all seen the cute little filters on social media, those doggy ears, the hearts, the smoother skin, the bigger eyes. Dr. Richard Chaffoo is here with more on the rise in patients wanting to look like they do in filters. Dr. Chaffoo, I really try. I do use filters every once in a while to brighten, but I really try not to do the rest of
Distort it too much.
Because I don't want people to think this is what we actually look like, but it's a thing.
Exactly.
It's a thing.
It is a thing. You're absolutely right, Jolla. And social media influencers have actually had a big impact upon how many people see themselves. Sometimes, as you said, in a good way, and sometimes in a distorted manner as well.
Okay, so there's a fascination now with plastic surgery. You see these images on Snapchat, and you see them on Instagram, and whatever you see.
Right.
And people come to doctors like you and say, make me look like this?
Well, actually, that's the rare situation, but you're right. People do bring in images, oftentimes bring in images that are actually an earlier version of themselves. But you're right, if they bring in a version, Jolla, that has been distorted to an extreme version, then it's something that's not really realistic. You can't really achieve that with a surgical procedure or filler.
Dysmorphia?
There's something called exactly Snapchat dysmorphia, which is having an over-obsessed belief in there's something about yourself that needs to be corrected, and you become stressed about it. It becomes the focus of your life. And so Snapchat dysmorphia indicates an underlying psychological issue more than something that we can correct with either surgery or a filler or a laser.
What are some of the procedures that they're asking to be done?
Well, so we're looking at people coming in wanting improvement in their lines or wrinkles, wanting their eyes larger, interested in nasal surgery, chin augmentation, removing the double chin. Those are very common things that we'll see.
Yeah, because you could do that all in an app.
Exactly.
You can really fix this, do this, lift this, open this. Okay, and then when patients bring in a Snapchat image, do they say, I want to do this? Is this something ideally you want them to base what they want to look like?
Well, I love imaging because plastic surgery, Jolla, is all about image.
Okay.
It's a right brain experience, and I like patients bringing in photographs of how they looked, say, when they were younger. What we'll do is we'll actually do some computer imaging to make some realistic changes. But what's helpful about some of these Snapchat photographs is it lets me get into the mind of the patient to see what they find attractive, and then most importantly, are they over-obsessed about the appearance, and are they looking for something that's not achievable with surgery where they'd have a bad outcome? The other thing about Snapchat dysmorphia is something for the overall called body dysmorphic disorder, or BDD. It indicates a serious underlying psychological problem. Those people at that point are really not great surgical candidates because if they have surgery performed, they tend to decompensate. So you want to rule that out early on, obviously.
I'm going to continue posting my pictures without the filters, maybe just to brighten my eyes, but that's it.
Sounds good.
Because I'm sleepy. Dr. Chaffoo, thank you for being here. All right, Chrissy, we're going to get it over.